And welcome everyone to this webinar for the public health community on tobacco products waste prevention and mitigation. And during this webinar today, you will hear from experts about the impact tobacco products have on the environment. You will hear about some policies and measures that could be used to mitigate this environmental impact. You will hear about some successful campaigns, like a campaign in Spain that has very effectively used an environmental-based approach to advance tobacco control in Spain. And you will also hear how those measures, those environmental measures, could be an important component to endgame strategies that aim to end the tobacco epidemic. So those will be quite interesting today. We have participants from all over the world with a large constituency from the United States. But very quickly, I want to give you a very quick update about ASH for those of you who are not familiar with the organization. ASH was formed in 1967, and until 2000, its main mission was to protect non-smokers' rights. That shift changed in 2000, where ASH took a more comprehensive approach to protect everyone, non-smokers as well as smokers, from the harm caused by tobacco. And we expanded mostly to a global approach, where we took a key role in supporting the development, adoption, and entry into force of the first global treaty on tobacco, the WHO Framework Convention on Tobacco Control. We worked to carve out tobacco out of trade agreements. We worked to integrate tobacco in the global UN development agenda, and as some of you may know, there is a tobacco target in the current Sustainable Development Goals of the UN. We work to integrate tobacco in the UN human rights agenda, for example, with the UN Human Rights Council, and actually operates under two principles, evidence-based and human rights-based. And now we're very interested in supporting novel endgame policies to help the world lowers smoking prevalence rates. And we're involved in a number of interesting actions, such as, for example, some of you may have heard, a case we're suing the FDA for not taking adequate action on banning menthol in the United States, menthol products, menthol flavored products. But on the policy side, we're particularly interested in addressing the supply side of tobacco products and rethinking cigarette sales. And that includes obviously addressing retail environments for cigarettes, tobacco products, and look at policies that can help phase out the commercialization of tobacco products, while also taking into account the need for people to smoke and are addicted to nicotine. And today with the COVID-19 pandemic, we really have seen the right to health being front and center, providing an opportunity to highlight the need to accelerate the evidence-based measures, but also to look at other areas of tobacco control that need work. And I think a critical one is really being the environmental impact that tobacco has, and also how do we mitigate this impact. Just picture that you have in front of you is one that was at the bottom of the mountain, a summit in Switzerland. It was last summer, just before I was about to start an ascent. And this was put by the Summit Foundation. So this is not a public health group, this is purely an environmental group. And they put this sign at the bottom of the trailhead, basically saying that any one cigarette butt can contaminate up to 500 liters of water. And I thought this was quite interesting because it's something that you do not normally see. You see cigarettes everywhere, unfortunately, as litter. And even our own tobacco control community, where we really worry about the health impacts, we often ignore the environmental impacts it has. So we're very fortunate today to have three fantastic speakers who will address this issue. A very quick housekeeping issue. You can start typing your questions during the webinar. You can use the Q&A section, which is, for me, it's at the bottom of my screen. And feel free to type questions already and address them to each one of the speakers. We'll start with the first speaker, who's Dr. Thomas Novotny from San Diego State University, who will talk about the Cigarette Butt Project, and we'll discuss policy implications of tobacco products waste prevention and mitigation. Tom, please go ahead.
Thanks, Laurent. It's a pleasure to be with you all today and talk about this issue that doesn't get that much attention, which is this tobacco product waste, what happens after consumption of tobacco, whether it's cigarettes or e-cigarettes or any of the other various tobacco products that oftentimes end up in the environment as waste. And it's something that we all see when we walk out the door on every street corner, every gutter, every beach. And it's something that can be prevented. So and it has both implications for the environment, but also for tobacco control. And the challenge is to bring these environmental perspectives and tobacco control advocacy together, because these things can lead to what we've now been considering as a tobacco endgame, thinking about creative and innovative approaches to tobacco use that help us push towards an endpoint. And this again focuses on the supply side, as Laurent was saying, such that we have the ability to change the product, change how it's used, and change, hopefully, its impact on the environment. So I'm going to try to page down here. Assuming we've got the control correct. There we go. Anyway, what I'm going to talk about today are some basic facts about tobacco product waste. We refer to this as TPW. Everybody needs an acronym, and this is the most useful one because it encompasses all of the tobacco products, not just cigarette butts. And it's environmental burden, and we're going to talk a bit about the economic side of that, which is always of concern to policymakers, much more so than perhaps just the even environmental nuisance. We're going to talk about the filter fraud and its implications, because the filter on manufactured cigarettes is the principal component of tobacco product waste. It doesn't go away. It's non-biodegradable plastic. We're going to talk about the tobacco industry responses to this issue, which are not surprisingly all about corporate social responsibility, but not real responsibility. And we're going to talk about some policy solutions that I think can be appealing both to the environmental community and to the tobacco control advocacy community. So as Lauren was pointing out, cigarette butts are a ubiquitous problem. They're the #1 littered item on roadways and items of trash on beaches and waterways worldwide. And this is not surprising. When you look at the data from the Ocean Conservancy's annual beach cleanups, this is a global effort done by volunteers throughout the world. And in fact, it does get support from the tobacco industry directly to the Ocean Conservancy. This is a little bit dated, but the data are still the same every year, that about 1/3 of all the items picked up are cigarette butts, filters. Now, of course, we're starting to see pods from Juul and electronic cigarette pieces as well. But the overwhelming number of items picked up are cigarette filters. Again, mostly the filter because it's non-biodegradable plastic. Well, you know, these things, are they harmful? Are they toxic? Are they of concern to policymakers? Well, first of all, they should be concerned to all human beings. One specific piece is that they're sometimes consumed, whether accidentally or on purpose, by children, animals, and wildlife. And you know, animals and children are indiscriminate eaters. And in this picture of a black black skimmer bird taken by an Audubon photographer last year in Florida, the bird was actually feeding a cigarette butt to its chick. This is enough to activate many people in the environmental community especially, but it should be a signal for all of us to take some actions. So in addition to that sort of consumption piece, there's chemical contamination from cigarette butt waste, tobacco product waste. In the upper right-hand corner is a display, and Hudson will talk more about this later, of Juul pods picked up from schoolyards around the San Francisco Bay Area. You can see the green ones are mostly flavored with menthol, and then the storm drain to the left is typical of storm drains around the world. These products contain nicotine, ethyl phenol, heavy metals. These can contaminate waterways, and we've shown in the laboratory now some opportunity for these chemicals to bioaccumulate in the food chain that may in fact then create human health risks. Well, how much waste is that? Well, there's almost 6 trillion cigarettes smoked each year globally. This is going up in low middle income countries, going down in developed countries. But each pack of cigarettes, of 20 cigarettes, is about 3.4 grams of filter material, which then can be estimated as the sort of total butt waste or product waste. And in the US, that's amounts to about 50 million kilograms of toxic waste each year deposited into the environment someplace. Now, we don't know how many of those 6 trillion are for sure tossed, but we know from surveys that anywhere from 25 to 60% of smokers report that they've been dumping their cigarette butts somehow into the environment, whether it's just flicking them or taking their ashtrays and dumping it into a sewer or even into landfills. So this also doesn't include all of the other stuff, the packaging, the lighters, the matches, the other tobacco products, e-cigarettes. So there's more and increasing significance of these as e-cigarettes have become much more popular. We've looked at the toxicity of these using an Environmental Protection Agency protocol where we actually exposed organisms, both saltwater and freshwater fish in this case, to leachates, that is the water that's contaminated with cigarette butt waste, where it's constructed into a slurry and diluted in a way so that we can actually tell what concentration of cigarette butts in a liter of water would be lethal or would kill the fish that are exposed to it. And this is a protocol that allows us to identify the product, the subject material as toxic, hazardous waste or not. And this is in the aquatic environment, but there are also tests for other kinds of environments as well. What we found was on this chart, which is a little bit hard to explain, except for the fact that you see on the left side axis the figure of 50%. And what that means is that when these butts are soaked in water and the fish are exposed to them, half the fish die with 1 cigarette butt in a liter of water. So that's 1,000 cc's or about a quart. And that's enough to call cigarette butts toxic hazardous waste. The lethal dose 50 is 1 butt per liter. So that gives us some information about why they should be regulated and also why we should be concerned both in terms of the long-term effects. When you think about this, 6 trillion, it's every year. It's not just, you know, one time. And this has been going on now. Filters have been on the market for more than 50 years. We've also looked at sort of the economic burden of this tobacco product waste. You know, we're able to quantify the number of butts. We're starting to be able to kind of consider the toxicity, but now we can actually look at what the cost is. At the local level, this was done in 2010 in San Francisco, where the estimates were the cleanup costs basically for cigarette butts on the streets of San Francisco. And it was found that looking at all of the costs and the sort of burden on the city, a maximum permissible fee was established. That is what it costs to clean up cigarette butts. And that was at 20 cents per pack. And of course, the tobacco industry sued over this assessment because it was like a tax, but actually it's a fee that supports a program, the administration, the public education, and the cleanup costs for the city. This went into effect as a law, and actually the fee has been increased to 75 cents since then. Just this year, about a month ago actually, or a little over a month ago, we did a larger study on 30 US cities and found that the average cost per city ranges from $4.7 million to $90 million per year for just cleanup. And that doesn't include any sort of indirect things like effects on public welfare or the sort of environmental sort of integrity. But anyway, this adds up to about $265 million per year for these 30 cities. Now think about that in terms of the entire country as well as other places that might be affected by cigarette butts similarly. We've looked at the laws that could be applied here. And if you think about it, I mean, the environmental laws are really the key issue here, not so much the tobacco control legislation. These are hazardous waste under California law, and so the people who generate this waste, whether it's the individuals or the communities that allow that waste to accumulate, must ensure that these are disposed of properly. Well, most cigarette users don't do that. The tobacco industry certainly doesn't. And now we have something called the trash amendment to the California Clean Water Act, which prohibits anything trash-wise greater than 5 millimeters in size from going into our storm drains. And this has to be done within the next 10 years. Otherwise, the communities that are responsible for that allowance are going to be fined or, enforcement procedures taken to make sure that they do this. That means some sort of interventions, whether it's catchment or prevention of the waste, needs to be put into place. In addition, smokers are not warned about the danger of cigarette butts to the environment. So there's no label on them saying that this is hazardous waste and should be disposed of as such. And finally, the most important thing I think that we all can probably identify with is that cigarette butt waste and tobacco product waste in general is a public nuisance caused by the tobacco industry selling their product used as directed and not taking any responsibility to prohibit or prevent the environmental burden that these things cause. So this may spur action towards some sort of regulatory approach to cigarette butt as a waste problem. The filter itself, I just want to make a comment here. They're made again of cellulose acetate, which is photodegradable under direct sunlight, but it's not really biodegradable. Things can just break up into small pieces and still contain the toxic chemicals that we've mentioned already. So they continue to leach out no matter what. And just think, again, we've been doing this for the last 50 years with cigarette filters, and there's no end in sight to this sort of contamination. And so we should be able to identify it. And we're doing some research now in natural reserves and other areas to identify whether or not we can pick up the chemicals in the soil or water that's been contaminated by them. The filter is a fraud. It doesn't protect anybody's health. This is a marketing tool that's been used since the scares about lung cancer back in the 50s were first published, 50s and 60s. And every company, and in fact, lots of health organizations, including the US Public Health Service, were promoting less hazardous cigarettes. And so these filters were oftentimes seen as the answer. They were advertised in medical journals, and we've found since then, and the courts have verified the fact that there is no such thing as a safer cigarette. The filter is a way of trying to convince people that it provides health protection where it really doesn't. There are health risks. The National Cancer Institute published a monograph in 2001 that said that there was plenty of evidence to show that there was no benefit to public health from the design of the cigarette that's been evolving since the 1950s. The Surgeon General's report in 2014 also said that there was sufficient evidence now to conclude that there's an increased risk of adenocarcinoma, which is a more aggressive type of lung cancer, as resulting from inhaling more deeply with this more mild sort of smoke that's filtered from the cigarette. That means that the lung cancer cell type has been changing in response to the cigarette filter used over the last 50 years. Filters make it easier to smoke, to inhale more deeply, and therefore they sort of defraud the smoker into thinking that he's doing something, he or she is doing something to prevent cancer. So we've seen this, and this was a publication from the Journal of the National Cancer Institute. And basically all I want to show is that this is adenocarcinoma incidence for both men and women. And you can see that it's actually increased over the years, whereas other forms of cancer, lung cancer that is, have gone down. And that's the more significant evidence that we can say filters are not good for you. The industry's response, again, as I mentioned, is corporate social responsibility, blaming the victim, educating smokers, in other words, pocket ashtrays, downstream solutions, picking up butts with supporting voluntary groups to do this, sponsoring anti-litter campaigns, but really avoiding any responsibility as producers. They did try making biodegradable filters. These were not found to be marketable. And in fact, a biodegradable filter would just encourage people to continue to toss their butts out without concern for the environment. Just recently, again, just last month, Philip Morris International launches Our World is Not an Ashtray initiative, where they're trying to address the plastic litter problem. Well, their own surveys show that smokers don't understand that cigarette filters are made of plastic. 75% thought that they were made of cotton or paper. Only 13% knew that they were made of plastic. We find that this is probably less than what the general population understands by now. They are, again, working with NGOs, providing funding for groups such as Ocean Conservancy, Keep America Beautiful, and now Literati, which is, started up to help identify the distribution of cigarette butts and other waste around the world. They're good folks in general, but this becomes a subversion of the efforts to prevent tobacco product waste. Well, what they're saying is that they want to make cigarette butt littering socially unacceptable and to nudge smokers to have more responsible habits, launching general population education programs, cooperating with governments and local authorities to ensure there's adequate waste disposal. In other words, shifting the responsibility to the community, whether it's voluntary groups or governments. This is not prevention. It's our downstream approach. So the policy initiatives that I just wanted to emphasize in response to this challenge is to raise public awareness. And again, butt pickups and cleanup campaigns really do help to do that. We did them on our campus at San Diego State University, and the vision of these piles of cigarette butts are very moving, and we do have now a smoke-free campus that was helped by this sort of demonstration. We want to publicize the environmental and economic burden. We've got a study now going on to really narrow down the environmental costs on a city-by-city level so that communities can make some decisions about recovery of costs. We want to make sure that we join with advocacy groups from the environmental community to address this problem, because they're actually more effective and more concerned about the environmental side than the tobacco control community has been. Banning the sale of filtered cigarettes is what I think is the most important thing. We don't need filters. They don't do anybody any good. They're a marketing tool. They increase adenocarcinoma. They are non-biodegradable plastic pieces that are an additive to cigarettes that can be banned, just like flavorings can be banned at many levels, local or state or national levels. Assessing litter fees is one way of adding cost recovery to the sale of tobacco products. Then raising the price, of course, reduces consumption, as we know with the tobacco taxes. And then finally, litigation may be done when we know this economic cost. This is a burden that's borne by communities, whether it's the tobacco, whether it's the jurisdictions or NGOs or land trusts or whatever. They have the ability to recover costs if the litigation can be brought to bear, and when we've shown that this is a possibility as a public nuisance primarily. So I'll quit there and turn it back over to Laurent, and hopefully there'll be some questions later. Thank you.
Thank you, Tom. And there are indeed a number of questions that are coming up, but we'll address them later. Our next speaker, who's from the representative Public Health Law Center, is just a second, I have my Hudson Kingston. And he will describe how tobacco control can protect the environment to promote public health as well as social justice. With a focus, he will also address some of the new tobacco products. And he will also propose a list of policy options that jurisdictions could consider. So in addition to the ones that Tom just shared with us. Hudson, please go ahead.
Great, thank you, Laurent. Thank you for having this wonderful panel, and I appreciate getting to be on it. Yeah, as Laurent just said, I am going to be covering environmental justice, novel tobacco products, and hazardous waste. This photo of these young men from Nebraska in the US is from a playground cleanup where they found copious amounts of tobacco waste, including an e-cigarette, as you can see them picking it up there. I am talking to you from Minnesota. Let's see if I can cycle my slide. There we go, at the Public Health Law Center. This is in St. Paul, Minnesota, and we are on Dakota land. The Public Health Law Center has existed for 20 years and works on commercial tobacco control, healthy eating, and active living. At the Public Health Law Center, we provide legal technical assistance, which means we do legal research, we help people with their policy development, we do publications and then trainings like this one. We don't represent clients directly and we don't lobby. At the Public Health Law Center, we believe that health equity is a part of everything that we do, and it's especially true here. We know from studies, several of them by Dr. Novotny, that tobacco product waste accumulates where tobacco products are used and sold. And coincidentally, where they're used and sold, because of the tobacco industry's targeting of communities of color and low-income communities, is those same communities. So when talking about policy solutions, especially at the end, I want everyone to be thinking about ways that more resources can be given and things can be planned to protect those communities first who have been most disproportionately impacted by these problems. Today, I'm going to be talking about what is environmental justice, how do tobacco products cause environmental justice harms, how the FDA has existing duties to incorporate environmental justice into its decision making, and how advocates can talk to the FDA about that. And then also we'll be talking about local policy options for promoting environmental justice in tobacco control. First of all, the environmental justice movement has been around since about the 1970s, and it really sprung out of the fact that even though we had a lot of environmental laws at that point, they weren't doing anything for communities of color and low-income people. This report by the United Church of Christ from 1987 identified that 3 out of 5 Hispanic and Black people were in communities that had uncontrolled toxic waste dumps right where they're living. And frankly, things haven't gotten a lot better for these people, and the movement has continued to grow and to address new and more important, or equally important, but big issues. In 1991, the movement came up with 17 founding principles of the environmental justice movement, and I'm going to cover just 3 of them today. Obviously, all 17 are great, and you should check them out. First of all, environmental justice demands that if a company is making toxic, hazardous, or radioactive waste, that they stop doing that, and that they remain fully accountable for the waste that they've created and that has accumulated thus far. Furthermore, the environmental justice movement does not view these companies as stakeholders. They do not have a seat at the table. They oppose the destructive operations of these multinational corporations. And then finally, environmental justice recognizes that all of us as a group have to stop engaging in practices that cause this waste. So while recycling is very popular and everyone likes it, it really isn't, it doesn't help these types of communities where all of the waste eventually ends up accumulating. What we have to do is talk about ways to help people to a different way of living, especially in tobacco control, dealing with an addictive product, help them to live in a world where we're not producing these wastes that harm others. While there isn't an environmental justice law at the federal level quite yet, there is an executive order signed by President Bill Clinton that requires agencies to incorporate environmental justice decision-making into everything that they do. And that means consulting with these low-income and communities of color and Native communities whenever they're making big. As a result of this executive order, there has been guidance promulgated by many federal agencies, including the Department of Health and Human Services, which has oversight over the FDA, and the Council on Environmental Quality, which really oversees one of the laws I'll be talking about later. Now, just to talk sort of quickly about the environmental justice impacts of commercial tobacco. This is in addition to everything that Dr. Novotny covered, but globally and in the United States, commercial tobacco contributes to significant deforestation, pesticide overuse and contamination of waterways, child labor, both inside the United States and outside, decreased food and water security, huge climate change emissions due to the deforestation and the burning of wood to cure tobacco, and then mismanaged industrial waste. All of these impacts hit communities of color far harder than people as a whole, and that needs to be acknowledged and thought about more deeply. In addition to other commercial tobacco impacts, e-cigarettes and heated cigarettes like the IQOS product that's coming out have additional problems, mostly owing to the fact that they are electronic devices. They're gizmos with big batteries. In the case of e-cigarettes, they contain commercial chemical products, and they are made often to be disposed of just willy-nilly, much like previous tobacco products have been. But as a result of the fact that they are electronic products and because of the way that the markets work, there are more resources extracted in dangerous ways, mostly abroad, for these types of products. So for example, on the left, you see that a lot of the nicotine that's being used in America's e-cigarettes is being grown in places like Zimbabwe, which have very, very poor labor practices in the tobacco industry. And then on the right, you see that to make lithium-ion batteries like the type used in many of these e-cigarettes and the IQOS, child miners are dying in the DRC trying to get the cobalt that goes into these products. And it's not just the resource extraction phase, it's also processing. So there's a giant lake in Inner Mongolia that's been absolutely destroyed by processing of minerals and other chemicals for technology development. And then these products, these inputs are used to make e-cigarettes, often in Shenzhen, China. So Dr. Novotny talked about hazardous waste, and hazardous waste is very important to the environmental justice movement. Are e-cigarettes themselves hazardous waste? Well, nicotine has been listed as a hazardous waste, an acute hazardous waste, since 1980 in the United States. And this is because it has been long used as a pesticide. It's very good at killing things. And as a result, it has been listed as the most severe type of commercial chemical waste in the US because it is deadly or very harmful in small doses. This is the law across the United States in every state. The question bubbled up in 2015, does that apply to e-liquids, which only contain some nicotine? And EPA answered yes. Because nicotine is the sole active ingredient in e-liquids, it will be treated exactly the same as a purer form of nicotine, and it must be disposed of in keeping with all of our hazardous waste laws for these most dangerous types of chemicals. Even under the current administration's EPA, under a rulemaking from last year, they determined that nicotine is still acutely toxic. There is no proof otherwise, and that they are going to continue to apply the RCRA hazardous waste regulations to these products. And this is despite the fact that FDA has oversight over tobacco products. Because FDA has not certified any of these products as safe, it has not reduced the amount of nicotine in any of them. So it has not really exerted any sort of authority that would make them anything different from the original pesticide that got its listing. In addition to nicotine, the batteries that are in these products, and these have been pulled out of e-cigarettes, are often going to be hazardous waste in the United States as well, certainly across California and states with strong laws like theirs, but even in states like my own, when the batteries explode and light on fire, they have significant characteristics that make them into hazardous wastes that have to be dealt with in very careful ways and not thrown into the normal garbage. And even now, we are on our 5th generation of e-cigarettes that are these disposable ones that are made to be thrown away, that have all of the features that I told you about, and then it's a hard mixture of those features. You can't really separate the nicotine vessel from the battery, from the electronics, and as a result, it makes it much more difficult to dispose of these legally or adequately. This study that Dr. Novotny applied or mentioned earlier really shows up how this plays out, because a lot of this, this stuff that needs to be disposed of under hazardous waste laws is accumulating at schools. We discovered from this study that at the higher income schools, there was a lot more of the e-cigarette waste, and lower income schools, there are a lot more of the menthol cigarette butts and little cigars. But it really shows that different communities are going to have different environmental impacts based on the income and the targeting that the tobacco industry has used on the people who live there. One reaction we've seen from Boulder County, Colorado, is this great explainer that was done with hazardous waste, public health, and education authorities working together. And really the bottom line here is that they say the best way to avoid contaminating the environment with vape waste is to avoid using them altogether. There's really no way to use these products that wouldn't harm the environment the way that they're built. Now I'm going to quickly talk about, I know that I mentioned that the EPA said FDA has done nothing to regulate e-cigarettes. Will the government do anything? Do they have some authority to do this? Well, under the National Environmental Policy Act, any major federal action that has the potential for significant environmental impacts has to be assessed. This is a law that's similar to the environmental impact assessment in India. It's been passed in over 100 countries. Authorization of new tobacco products or any authorization from a tobacco industry application is going to be subject to this type of NEPA review. FDA has conducted hundreds of these reviews already, and they're posted on their website since 2014. And in doing these reviews, FDA is subject to both the Health and Human Services and Council on Environmental Quality guidance that I talked about earlier, as well as the executive order. And don't just take my word for it. This is a presentation that FDA did in 2016, and they say that some of their actions subject to NEPA are the requests for private action by tobacco industry. So that's authorizing new products, authorizing several types of other products. And for example, a recent review was done on new cigarettes by R.J. Reynolds. If you look in this somewhat boring document, you'll see that they did do a section on environmental justice. And unfortunately, it's woefully short. It's 2 sentences long. They did not really consult with any of the communities they were supposed to. They didn't really talk about the disproportionate impacts on certain communities. They really took a pass on their responsibilities under the guidance. If you look at the ICOS analyses, there's actually 2 of them that the agency put out. It's slightly longer. It's about almost a whole page. And it does talk about how this new electronic device is going to have different impacts on the environment from the cigarettes that it's supposedly going to be replacing. It's not really as detailed as I would think it should be, but it definitely has evolved in analysis over time. And what we see if you look at a lot of these assessments, they really concentrate on use and final disposal with a little bit of discussion of manufacturing, but they take a pass on all of these other impacts to the environment from cultivation, curing, processing, and distribution. So the things to remember, and I'm sorry about all the text on this slide, but the things to remember is that every new tobacco product will have to undergo this NEPA review. And as FDA does review of e-cigarettes under a court order starting this September, advocates should be able to submit comments to talk about how there are environmental and environmental justice impacts of these products. FDA's compliance with NEPA has evolved over time. It's definitely gotten more complex, but it certainly hasn't gotten as far as I would think another agency has. And without adequate environmental review, none of these products, so no e-cigarette, could be legally authorized for marketing at the end of this process. So taking a page from the environmental organizations, it is possible that lawsuits could be filed for inadequate reviews to stop authorizations that are not in the public interest. Now I'm going to talk quick transition to local action because not everyone wants to work at the federal level. And this is also going to be relevant to people outside of the United States. Probably the strongest way to deal with tobacco product waste, like Dr. Novotny said, is to do sales restrictions. It's the best option for public health and the environment. You would need to define which products are the worst for the environment and prohibit the sales of those products. Obviously, prohibiting the sale of all tobacco products would be better. And this works on the example from Brazil, Canada, and the EU of national or international prohibitions on flavored products, or at the US of local flavor prohibitions. This is just using the same tool, but to target products that cause undue environmental impacts. At the US level, under our existing hazardous waste law, there's numerous things that can be done. For example, in Colorado, they have issued statewide guidance on schools on how to comply with the existing hazardous waste laws. And as I already talked about, Boulder has done some really good jobs of making educational materials for folks about why their vaping habit is detrimental to the environment. But really, I think that the opportunity here is cost shifting. States have a lot of authority of enforcement of hazardous waste laws, and they could pass costs back to the industry that's creating these problems at schools and in other parts. They can charge fees for the ultimate disposal of the products, or they could have deposit systems where someone has to take the e-cigarette back to the retailer for appropriate disposal after they've used it. Finally, as Dr. Novotny already covered, there is the public nuisance angle too. There's both litigation and regulation. And we've seen lawsuits against Juul. Many states and over 100 school districts have sued them, many under a public nuisance theory of harming public health as a public resource. But then also, as we're talking about, every state has laws that prohibit the corrupting or rendering unwholesome of impure or waterways. That's just an example from Nebraska, but every state has laws of this type. And at the local level, often jurisdictions can determine something is a public nuisance and deal with it without having to go to court. So anyway, that's my contact information, and I hope that we have some great discussion at the end.
Thank you, Hudson. And I will move on quickly then straight to the last speaker, then there will be plenty of opportunities for Q&A. Our next speaker is Raquel Fernandez Megina, who's the executive director of nofumadores.org in Spain, which is a non-smoker rights organization. And she will share a recent successful campaign in Spain that introduced an environmental based element to it to advance tobacco control, and has had even implications now, even in the context of COVID. Raquel, please go ahead.
Well, thank you very much for organizing this webinar, and thank you for inviting me to be a panelist on it. For those who doesn't know what non-smokers.org is, non-smokers.org in English, we are a tiny citizen organization who advocates for the right to live in a tobacco smoke-free world. We're really small, but we have been working on this for almost 16 years. We do have this campaign, Smoke-Free Beach campaign. There you go. So why did we choose the Smoke-Free Beaches, among others, as a campaign instead of, we could go for bars, terrace? So the reason was because Spain has almost 5,000 miles of coastline and lives off tourists. Because beaches don't have an owner, a private owner. I mean, it's owned by, they are owned by everyone. So we won't encounter any direct opposition from a specific person or entity. So in that moment, there were also a number of smoke-free beaches in Spain. And we thought the city council would like this idea of reduce their cost of cleaning the beaches. Plus, we thought we could find a support, the support of environmental groups and a big amount of population, especially young people, who are really concerned about environmental issues, but not about public health ones. So we thought that we could have them as an ally. So what we could get with this campaign? Obviously, we could raise visibility of the problem, increase social awareness, encourage policymakers for a higher demand for smoke-free spaces, and facilitate, the government expanding the ban to other similar outdoor spaces like swimming pool, national parks, gardens for kids, anything you could think of outside, outdoors. So what was the scenario in Spain prior to launching our campaign? Well, Spain is a peninsula, and we also have a number of islands. So that means we have over 3,000 beaches in our country. In 2006, the first smoke-free beaches was declared in Spain, in Catalonia. And in 2012, Galician municipality of Bayona copied the idea of, from New York of having a healthy and ecological sandbar. So they banned smoke from 2 of their beaches. So that was a success. Even though people were not fined if they smoke in that beach, they were only informed. So, but still was a big success. And 2 years later, 2 more beaches joined the program. This all together with another smoke-free beach in Canary Island and the one in Catalonia meant like 0.5% of our beaches. But we can see that the idea grew, and by 2018, when we did start our campaign, the number of smoke-free beaches had increased up to 91. That meaning like 3% of all beaches. So in August 2019, we launched our Change.org campaign, Smoke-Free Beaches, and we were very surprised that a few days later, we had over 107,000 signatures. That was a big success. So our next step was to launch the campaign in English, looking for international support. This was the logical move, since tourism had become sector that contributes the most to the wealth of the Spanish economy. So after that, by fall, we have reached over 128 signatures. So we decided to take them to the health ministry. And we were received by the general director and deputy director of public health. And we could, on top of giving them, deliver all these signatures, we had the chance to talk to them about another initiative and proposal we have to advance in tobacco prevention. So we were congratulated on the proposal and all these measures we did propose, and it told us that these initiatives help the policymakers to change laws. So the main message we were given is make noise and help us to help you. So over a year, we kept gathering signatures, and this year, on the occasion of World No Tobacco Day, we delivered almost 230,000 signatures of our Smoke-Free Beach campaign. So due to the COVID pandemic, we decided to deliver it virtually, and we sent by email not only to the health minister, but also the Minister of Ecological Transition and the President of Spain. So, and also we decided to email to 55 different city councils in our coast, requesting to implement a smoke-free beaches programs. So as a result, in our first encounter with the ministry, as I told you before, we received our initiative with enthusiasm and told us that those initiatives help policymakers to go ahead with this kind of measure. And actually, also in May 2019, the Public Health Commission of the International Council approves its lines of action in the field of tobacco prevention and control. And one of those measures is to promote the expansion of smoke-free spaces to other outdoor spaces, such as sports and leisure centers or private vehicles, among others, and support good practice initiatives such as smoke-free beaches. So the first time the whole ministry speaks about smoke-free beaches in an official document. As a result of the second delivery of our signatures, the cabinet, the director of the cabinet of the presidency of the government reiterated us their gratitude to inform them about this proposal and initiative, and that contributes to reduce the pollution of Spanish beaches and coasts. On top of avoiding passive exposure to tobacco smoke in Spanish beaches. We are also answered by the Minister of Health himself, informing us that they will work alongside with the Minister of Ecological Transition on the Smoke-Free Beaches initiative. So that's a big success. I mean, they keep in mind our proposals for their polishing. And also as a result, we see that the social support is very high and keeps growing. Here you can see a few headlines, one of the region of Murcia, another of the region, the Balearic Island. In one, 90% of population, and in the other, 72% population of citizens support smoke-free beaches initiatives. And here to the right, you can see the number of signatures or smoke-free beaches initiative in Chains.org has gathered. It's over 250,000 signatures, which are a lot for us. So we can see that every summer the number of beaches that join smoke-free beaches programs increases. And this is a sign that citizens support and encourage coastal city councils to implement them. So by this year, the number of smoke-free beaches has increased up to 475 beaches. That means almost 60% of our beaches. If you compare that with the 3% we did have 2 years ago, you could see it's a big success. And we can see, well, almost like every month in or the newspaper will come out with a new beach that will enjoy a smoke-free initiative. Here in January, Mijas did it. Then in February, Cangas beach, that's up north. And in March, it was San Roque in Andalusia, south of Spain. Here in May, one of the city councils that we wrote asking for this kind of initiative decided to implement a smoke-free beaches program. In June, you can see another one. Actually, there were more than one every month, but I cannot walk you through each of them. And here in July 2nd in Cadiz, South Spain, that was one of the ones we wrote too. And then in August, I want to stop in this case because we work together with this local group who actually opened their own change.org petitions, make Carabasi Beach in Elche a tobacco smoke-free space. And after gathering a number of signatures in their petition, they asked us to write to their mayor supporting their request. Actually, in August 4, it was a reality. Carabasi became the first smoke-free beach in Elche, this little community. So that's the Smoke-Free Beaches initiative and campaign in Spain. But before ending, I want to walk you through what's happening in Spain right now in outdoor spaces in coronavirus times. This is the latest news, and this is going to be some very interesting for you. Well, we have seen for all these pandemic times, all these months, that more and more studies that have told us, has shown how tobacco has a great, a bad impact in the person who are infected by the COVID-19. I mean, they have more chances to have a really bad turn of the disease or even to die. And also, there are other studies that show that the aerosols might help the COVID-19 to spread. So, smoke helps infection. So what we did during all these months with the lockdown and everything, we have been pushing the health minister to do something about smoke, about tobacco, to keep tobacco in their minds when they talk about coronavirus, not to ignore it. I mean, they have to do something and keep tobacco in mind. So we did complain with our change.org initiative when the tobacco stores remain open during the pandemic, the worst part of the pandemic. We did write to the health ministry and to the president of Spain, saying that they have to keep tobacco in mind. And we lead this manifest to urge the Spanish government to declare outdoor hospitality industry space smoke and vapor free. We did gather the support of 32 other organizations these are the main tobacco control organization in Spain, scientific, medical, nurses, patients, consumers, us did sign it too. So we sent this manifesto to the health minister by the end of July. And we also opened this campaign, Smoke-Free Terrace Now, that has gathered up to 94 supports, 94,000 supports. And we're about to deliver that to not only to the health minister, but also to the regional governments. So after all this pushing, one day we woke up and we defined this news in August 12th. The Galicia government bans smoke on the street or in terraces if safety distance cannot be guaranteed. Well, this is amazing news, but it has a tricky part, and it's a safety distance, which is 2 meters apart. We know that 2 meters apart is not enough to keep the pandemic to spread through the tobacco smoke and vapors, but obviously it's a huge step, and everyone starts talking about it. And we see that 2 days later, the health minister announced that the smoking ban in the street will be all over Spain in an agreement with all the regional governments. So again, the tricky part when the 2 meters apart is not enough, but all of a sudden, this is all over the news. Everyone talks about it, TV, magazines, newspapers, and that helps one of the Spanish regions, Cantabria, to materialize their smoke-free beaches project and decides to ban smoking in all their beaches. So this is the first region of Spain which actually bans smoke in all their beaches, all of them. So as you can see, the issue is all over the media, and we can find these great headlines like this one for last August 21st, when it says, "Stop smoking on the terraces. The coronavirus drives a giant step in the public health strategy against tobacco." And here to the right, you can see a few of my declarations of myself, where banning tobacco from terrace will help to denormalize the consuming of tobacco, especially in a country where we do have the most bars and restaurants per capita in the world. And all of a sudden, this is yesterday's news, Balearic Islands decides to ban smoking in all public places, outdoors. So the smoking ban in the Balearic Island is in any public spaces, regardless of distance between people. And this we were asking for. And we're gonna keep pushing our regional governments and the health minister that, to be honest, we don't think that will remain after the COVID pandemic. We mean the smoking ban in the street, but we really hope that it remains in outdoor terrace in the hospitality business, because I think that it's going to be before and after the COVID pandemic in the tobacco control problem in Spain. So Let's hope for that. We're gonna work really hard to push it. And that's all I have to tell you. Thank you very much. There is my contact. And I'll be glad to answer any questions afterwards.
I'll go straight to the questions, given that we went over time, but I see we still have a critical mass of participants. And one of the questions that comes up quite often is about enforcement. If you start talking about enforcement in beaches, in public places, how does that work, and who's in charge of that? What are the type of penalties that we have at this place, and who's responsible for cleaning up? And given that, and that there were questions also earlier beyond, and maybe some of you may want to address that, is where's the general cost for communities in cleaning up the litter associated with litter? But maybe all of you have been involved in similar initiatives, so if you can discuss the issue of enforcement.
I can maybe start just with basically, we've had smoke-free beaches here. Actually, the first smoke-free beach in the U.S. was in Hawaii, in Hanauma Bay. The one here in the mainland was Solana Bay, which was here near San Diego. And what we think is that most of these become self-enforcing when there's a social sort of standard set that, yeah, this is not good for the beaches. It's important to obey the laws. What we find is that there's a lot of things that are missing. Signage that is important, that it's maintained. Here, the police are not prone to want to enforce smoking restrictions. They may provide some information. I think Raquel has mentioned this in the past, without necessarily levying fines. It's very uncommon that happens, although it's oftentimes built into the law that there's a fine for smoking on a smoke-free beach. The individual lifeguards, that is the people who watch over the beaches for public safety, are really the ones that are responsible for that here in Southern California. And again, their priority is life-saving rather than smoking enforcement. So what we hope is that with increased social normative change, that these things become self-enforcing. That's really been what's happened in sort of clean indoor air legislation that becomes social normative change, and with time, people start to obey the laws. Now, of course, there's lots of scofflaws and people that don't pay attention. When we have self-enforcement, that means sometimes people will tell others who are smoking that it's not permitted. But again, I think this is an evolutionary change with lowered smoking prevalence, increased sensitivity to the environmental side. There'll be much more of this as a self-enforcing thing. And again, the police and lifeguards are very reluctant to do that enforcement.
Hudson or Raquel, would you want to add anything to this topic? And Raquel, particularly in the context of Spain also, but Hudson, do you want to go first?
I'd love to hear what Raquel has going for enforcement, so I'll cede my time.
Okay, well, most of the smoke-free beaches initiative in Spain, they are self-enforcement. I mean, most of them, there are no fines, but yeah, when the police walk through the streets, they inform that if there's any smoker, they will be told that that's a smoke-free beaches, and you can see signs and flags with smoke-free beaches initiative. But this is been a helpful first step to make the way people think and to encourage other citizens to make those smokers to quit smoking in the beaches, because that gives a person the empowerment to just go to someone next to you who's smoking. It's like, hello, this is smoke-free beach. You shouldn't be smoking here. And that, most of the smokers, I think they will respond by, putting down their smoke.
Now on the issue of enforcement and going back on this, so the idea of fines, so that might work if there were some fines, but to some extent, what bothers me a little bit is, and I see it criminalizes someone who's already a victim, someone who's basically in this context addicted to smoking and is using this product most likely because of an addiction, and so on and so forth. So I'd like to go back a little bit on this issue of putting the responsibility really back on the industry, and particularly given that filters they don't do anything for health. It's just about increasing palatability of the product. And even within the context of so we have a global treaty, we have an international treaty, which has clarified that anything that makes the product more palatable and more easy to smoke, anything that makes the poison easier to absorb, so to speak, should be banned, should not be included. And I think an interesting points have been made by the panelists about why do we have filters today when they don't do any benefit, and what should be done maybe to advance that concept, and for that to be considered seriously within the tobacco control community as a way to really reduce tobacco use and denormalize tobacco, so to speak. If you could speak about that, Tom, Hudson, and Raquel.
If I get to start, I think the important thing to realize that here in the United States, at least under the Family Smoking Prevention Tobacco Control Act, the legislation that gave FDA the authority to regulate tobacco products, it also gave the authority and very explicitly the right to local and state jurisdictions to regulate the sale of tobacco products. That doesn't mean that they regulate how the tobacco product is constructed or anything. That's FDA's job. But they can regulate the sale, which they are doing now with the flavors. So the same principles, flavors make it easier for people to smoke. They make it more likely that kids are going to get addicted. The same principle applies to filters. Since we now know that these have this environmental impact and are plastic particles that we're all dedicated to try to reduce in our environment, given the increasing knowledge of plastics' impact on the oceans, especially. There seems to be an ability to take care of this at state or local levels. People are not quite embracing this idea that they're not a health benefit. If there's some one person that may be protected by having billions of people smoke filtered cigarettes, and they're almost willing to take that sort of as evidence that there's something beneficial, but there isn't any evidence on that. And we're actually doing a study right now on a clinical trial of switching people from filtered to unfiltered cigarettes, a small trial to see what people think, how they perceive, what kind of comfort level they have, whether it changes their perspective on quitting, what are the biochemical markers that are changed, and what are the changes in puffing behavior that ensue. So we're going to have a little bit more evidence on this, but I think it really can happen at a local or state level where this product the sales can be regulated and make a big dent in the issue. Here in California, there are 2 communities that have now put forward total bans on all cigarette sales, all tobacco product sales, Beverly Hills and Manhattan Beach. Nobody's going to die from that. The economy is not going to collapse from that. The people's right to smoke won't be impaired. They just won't be selling this stuff in those jurisdictions.
And just to add to what Dr. Novotny was saying, yeah, I think that one of the big hurdles right now is education, getting the word out that this is the most littered plastic pollution in the world. There are many folks in California right now who will not pick up a plastic straw for the rest of their lives, but they don't blink when they see someone dump a whole pile of cigarette butts out their window. I also want to double underline the point that Laurent made that enforcing against litterers is not the point. It really has to go higher up the food chain. If you're enforcing against litterers, you've already lost this fight, because you have people who are consuming these products and it's harming their health and the health of the people around them. So really, we try to focus on policy solutions that go higher up the food chain and help those people to quit having a habit that harms both themselves and the environment.
I thought it was a very interesting concept of banning products, not only by the harm they cause to the human individual when they consume the product, but also ban the products that are more harmful to the environment in general. I was wondering also, so in the terms of practical approaches moving forward. So we have, for example, in California, in San Francisco, a very, very practical, what I think it was a very successful measure was to then put this fee on cigarette butts, given that they do cleaning up cigarettes does have a cost. And I see it, for example, in many parts of the world, in Switzerland, for example, a place that takes care of its laws and says they care about the environment. One of the public beaches, one of the biggest litters you see when you go in the morning is tons of cigarettes, and they're cleaning them with a hose, and actually they're throwing them right back in the river, which is not very good for wildlife and so on and so forth. So in terms of how do we advance then measures such as what was done in California, what would be good next steps to do that, and also practical approaches like in Spain, for example, what was done to reach out and work in cooperation with the environmental community. And I know that you also had examples like that, Tom, in California, working with Self-Rider Foundation. So what are practical ways to engage with the environmental community to address that? And what are practical ways to, given that we have not had success yet with this banning the production of filters, so to speak, but at least to put a fee on it right away, how could that be replicated in other parts of the world?
Well, again, I could start. What happened in San Francisco was they actually did a study, a very careful study, where they gridded out the city and found out what the burden of cigarette butt waste was in neighborhoods, plotted it out. We're able to work with the Environment Committee, the Environment Department, not the Department of Health, but actually the Department of the Environment, to estimate what the actual costs were that were attributable to cigarette butts in that environment. So it wasn't just a guess, it wasn't just an estimate, it was actually a real well done calculating study. That's not feasible for every community to do that, but if we can model the economic costs and bring those to the attention of policymakers, the economic piece of this, I think, could be very powerful, in terms of persuading now very economically strapped local governments to look at this as one way of doing a cost recovery. We know that adding a tax onto cigarettes reduces consumption. Adding a fee would also serve in that capacity as well, and that's now a very well accepted form of tobacco control. And it is something that I think would be palatable to many governments. But at the same time, at the environmental side, rather than just charge money for people to litter, to try to prevent this as an upstream approach, as Hudson has pointed out, is really the critical environmental issue. And it's possible to do this. We regulate all sorts of things in terms of their impact on the environment, but we haven't yet done that with tobacco, partly because the tobacco industry is so powerful and because they do subvert the environmental groups. There are dozens of environmental groups that get money from the tobacco industry and are not willing to speak up. Those that don't receive money are willing to speak up, such as the Surf Rider Foundation, Coast Keeper, Friends of the Earth, and some others. But some of the other big ones, like Nature Conservancy, Ocean Conservancy, do receive money. And it's difficult for me to understand how they can deny the impact of cigarette butt waste and not actually go after it in a very, very aggressive way.
Something for us to monitor. Hudson, I see you have your mic on mute.
Yeah, I was just going to respond by saying that as discussed already, so jurisdictions that have taxing authority could do something like San Francisco did. So they could put in basically a pollution tax and say, this thing is going to be pollution and we are going to make you pay for the externality that you're imposing on society. Jurisdictions that don't have taxing authority could also go with what I was talking about, where there's a deposit. So say every time you bought an e-cigarette, you had to put down a $100 deposit. I think you would bring it back to the store to get your $100 back. And as a result, it's all of the devices end up at a business that is then tasked with responsibly disposing of it. So you get the things out of the parking lots and out of the parks. And it is, as Dr. Novotny said, not a solution that prevents the production of this waste. For that, you'd want to go further upstream. But there are options for both. Different kinds of tobacco products might require different types of fees.
Great, and I'd like to give Raquel an opportunity to respond to the question about practical approach, how did you engage with the environmental community? And that will have to be the last question, given that we're way over time, but I see that we have a number of almost 200 participants still on the online. So I'm sure they would like to hear, how did you practically manage to make that relationship and that partnership with the environmental groups?
Well, in this case, it was easy because there were a few of groups that they were actually picking cigarette butts from beaches already in Spain, and who were aware of this problem already. So while it was easy to get those reports, the only thing that you have to go to their doors and you know how to reach them, look for them, and obviously they're gonna say yes, we will help you because your fight is our fight, obviously. So just look around. There are many, like those volunteers who pick up, who clean the beaches. They are organized in, you know, groups that they will help you. So you can see that the health society, the tobacco control community is not alone. You always have to look for another groups of people who will help you to support you. In this case, what was cleaning up beaches volunteers or environmental groups, but in other cases might be, I don't know, groups of parents or who knows.
And
I mean,
you said that a lot of from the youth, you noticed that in Spain, there was clearly a lot of support from youth. I do not know of any studies specifically that have looked at the youth support for that and whether that would make, that would be a good way to engage youth within our community. But I know, Tom, you've done some research maybe on this, but it sounds like that was critical in Spain.
We haven't, but you only have to look outside and see what's happening, like in the world meeting, environmental meeting. It was like Greta talking about how we are impacting our planet. So obviously, and see like you can see all these young people going every Friday to, you know, getting outside in the streets, just fighting for the planet. So obviously this is something that really matters to them.
And Tom, do you have any data done on some of the research you've done that shows that link that indeed youth, if you, to engage them via the environmental angle, will be a way to get them interested in advocating for tobacco control campaigns? Tom, you're muted.
Sorry. Yes, at Stanford University, we did a study recently of high school youth. They have a longitudinal panel asking them about first of all, their understanding about cigarette filters and what, you know, they're made of and what they would do if they didn't have them, and et cetera, and whether they would support certain policy approaches. And so we've got some information on that. That's been submitted to the Journal of Adolescent Health, and we'll see if that gets published shortly. We hope so. But I think more should be done to, at a national level, to see what understanding there is about this as an environmental issue and whether or not it can be addressed in a much more coordinated way.
Thank you very much. So thank you I want to take this opportunity to thank you, the three panelists, for those excellent presentations. Raquel, there were some technical issues with the sound, so we will suggest that maybe we will some other time just quickly do a video of your presentation so we can share it again, given that a lot of people do follow up and watch the webinars post-event. And I want to remind everyone, thank you so much for willing to do that, Raquel. And our next webinar is scheduled for September 10th. And this webinar will address best practices around smoking cessation, including for special populations such as those needing psychiatric assistance, as well as we will discuss research on why not everyone around the world has adequate access to cessation. And we'll be joined for that by Professor Dr. Martin Raw, He's the director of the International Center for Tobacco Cessation and a visiting professor at NYU at the School of Global School of Public Health. Rachel Smolowitz and Michael Strabos of Shepherd Pratt Hospital. And we're Caroline Dressel, who's a medical doctor and has been a leading catalyst in the area of human rights and tobacco, and as a strong, long-time volunteer for ASH. So thank you to all of you. Thank you very much. And we hope that we will see you at our next webinar. Thank you. Bye-bye. Stay safe.